This lotion is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations like diaper rash and skin burns from radiation therapy. Emollients are substances that soften and moisturize the skin, reducing itching and flaking. Some products are used to protect the skin against irritation, such as from wetness. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Humectants like glycerin, lecithin, and propylene glycol draw water into the outer layer of skin. This lotion also includes ingredients that soften the top layer of skin cells and help the dead skin cells fall off, leaving the skin feeling smoother and softer. For optimal results, apply this lotion as directed by your healthcare professional. Remember to always use this product as directed. Some products may need to be primed before use, so make sure to follow the directions on the package. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using this lotion to treat dry skin, you may need to apply it every time you wash your hands, throughout the day. And if you're using it to treat diaper rash, be sure to clean the diaper area well before applying the product. When using this lotion, make sure to only apply it to the skin and avoid sensitive areas like your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise by the label or your doctor. Also, be sure to check the label for any areas or types of skin where you should not apply the product and consult your doctor or pharmacist for more details. For the best results, use this lotion regularly and apply it to damp skin, especially after bathing or showering. If your skin is very dry, your doctor may instruct you to soak the area before applying the product. And remember, long, hot, or frequent bathing/washing can actually make dry skin worse. If your condition doesn't improve or gets worse, or if you think you may have a serious medical problem, make sure to seek medical help right away. Using Emollient combination No. 71 lotion is generally safe and effective, with minimal side effects. However, some people may experience burning, stinging, redness, or irritation. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it means that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you notice any unusual changes in your skin or signs of skin infection. While very rare, a serious allergic reaction to this medication may occur. Seek medical help right away if you notice symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's best to consult your doctor or pharmacist. As for the best time to use this lotion and the appropriate daily dosage, it's important to follow the instructions provided by your healthcare professional. If you have any concerns or questions about the use of Emollient combination No. 71 lotion, don't hesitate to reach out to your doctor. Before using this product, make sure to inform your healthcare provider if you have any allergies or if you have any skin cuts, infections, or sores. Some ingredients in this product may make you more sensitive to the sun, so be sure to check the label for any warnings. Your healthcare provider may suggest limiting your time in the sun and using sunscreen and protective clothing. If you have acne-prone skin, look for products labeled non-comedogenic to avoid worsening acne. It's also important to inform your doctor about all the products you are using before having surgery. If you are pregnant or breastfeeding, consult your doctor before using this product. When using Emollient combination No. 71 lotion, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Remember to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this lotion is ingested, it can be harmful. In case of overdose or serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical assistance. You can call 911 or your local poison control center for help. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. To help prevent dry skin, it's best to use lukewarm water when bathing, and try to bathe less often. Keep your baths or showers short and consider using a humidifier when the air is very dry. Emollient Combination No. 71 Lotion is just one type of emollient product that can help with dry skin. It comes in the form of a lotion and can be used to moisturize and soothe the skin. If you're sensitive to fragrance or other ingredients, it's important to consult with your doctor or pharmacist to find the best product for you. When using Emollient Combination No. 71 Lotion, it's important to follow the recommended dosage and apply it at the optimal time for the best results. If you forget to use this lotion on your regular schedule, just apply it as soon as you remember. But don't use extra lotion or apply it more frequently than directed to make up for the missed dose. Make sure to follow the storage instructions on the package and always ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, as it is under pressure. Do not puncture or burn the canister. Do not flush medications down the toilet or drain unless directed to do so. Properly dispose of this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.